Alright guys, it's Monday and I'm heading home. It's my first day shift of this week and it's been a crazy day, and I'm gonna talk to you about it in a little bit, hopefully tonight or tomorrow. It's been a hell of a month. I haven't been really checked in with you for 3 weeks. There's so many updates regarding my orientation and my new role as a nurse. Yeah, hopefully I'll be able to talk to you guys about everything by Wednesday, or not, probably by tomorrow. So, look, I am so tired. Anyways, have a good night, y'all. Bye. Hi guys, good evening. So I'm finally settled down. I already took a shower, dried my hair. So it was a really busy day. Like, I haven't been really checking out with you guys. So it's been probably 3 weeks that I haven't made any video. Like, I just tried to do a little bit of clips, but I didn't really do any updates. But today is Monday and it's my first shift of this week and it was already crazy. So I have me and my preceptor had a total of 4 patients. She took care of 1 patient that has COVID, and I don't remember what really that patient have, but I'm pretty sure that he has COVID and diabetes mellitus. And in my case, I have 3 patients that I've taken care of, or that I took care of this morning. So I had a patient that has acute pancreatitis and acute appendicitis, and the other one, or the last one, has a COPD exacerbation. So it was my first day, and if you came into the shift, it's being a new nurse is pretty hard. Seeing all these patients for the first time in your first shift, and every first shift of the week, I always get stressed because I don't know these patients and I have to read a lot of notes from upon admission from the ER, and the history of the patient on why they came in. I gotta check all the orders or the previous orders, meds that are need to be given, scheduled meds, PRN meds, anything like that. So it's a lot of reading. And being a new nurse, I don't know if you're like this, if you're a new nurse. I don't know if you're having a hard time organizing yourself, but I am really having a hard time. It's not as bad as the last time though. It's not as bad during the first few weeks. I've been in orientation for a month now, and I'm still not off orientation until middle of September, and that's the time that they're gonna evaluate me on how I did and if I needed more time to be trained. But yeah, I'm just having a hard time in adjusting. Anyway, I am finally a little bit confident in doing some care teams in the middle of the day. All the healthcare team will talk about each patient. For example, the nurses, the OT, PT, speech therapist, the doctors, the social workers, everybody in the team that is taking care of the patient. We're going to talk about the patients, what are her goals, what are her plans, if this patient needs to be discharged, or if this patient needs to have any consults with surgery. They need to talk to the social workers, or there need to be placement for, let's say, for a nursing home facility or a long-term care facility. So stuff like that. We just need a few updates. Or for example, this is also the time that you can talk to the attending physician if what are her plans, or let's say if there are any updates with the patient, let's say abnormalities with the labs, and then you want to know what the doctor thinks and what's her plan. So this is the time that you can ask a lot of questions. So I'm a little bit confident about that. I've been doing that. Today's was my second time to finally being confident in talking to the healthcare team. I mean, during the care team time, um, I've been trying to also insert some IV, and I've been successful for a few times now. I still feel a little bit hesitant. Like, I can find the vein, I can always find a good vein, I can initiate the IV. However, I'm always scared to push more because I always think that I'm hurting the patient. But I always push the IV line on the right vein. It's just I couldn't, you know, initiate more because I don't know, I'm just worried that I'm hurting the patient. So that's the only problem. So I need to be practicing more so I'll be confident in, initiating IV. What else? During the assessment, I'm a little bit confident now too in, assessing my patients and asking them questions, having conversation with the patients on why they came in, what's their complaints, if they are in pain. Like, I'm kind of a little bit more confident in having a flow and talking to my patients. Regarding the meds, it's still a struggle, especially if the patient has so many medications in the morning. Their scheduled drugs in the morning. It's a lot. Like, of course, I don't know almost all of the medication. There are times that I forget the meds or what they are for, what are the side effects. So before I go into the patient's room and, give them the medication, I have to double check what are the meds that I'm giving to them, just in case if they have questions, I will be able to answer. So I'm also struggling with that. But it's okay. What else? I'm still not confident in talking to doctors, like especially handling phone calls. My preceptor's been helping me with that. She's pretty good in doing that. As I've told you, I have already participated in our care team time, so I was able to speak with the doctors. What else? I've also I'm not really confident in handling reports to the next shift, and I've been doing that lately, and I've been doing well at least. And also it's really nice that I was able to talk to my patient's family over the phone. Like, they will have questions and I was able to answer. It's a really good feeling that I'm a little bit confident with that, and I was so happy because the family also told me on how calm my voice is, and I have a really sweet voice. So I have good feedback from the families of my patients on how I speak to their family or how I speak to the patient, which is really good, and I'm so happy about that. Another thing, I've been a little bit confident in discharging patients and giving discharge education to my patients, talking about, their next appointment after being discharged, new medications, on where to pick up their new medications and when to take the new medications that is being prescribed by the doctor. Some interactions or signs and symptoms that they're gonna develop once they get discharged, that they have to call, like for example fever or pain that is uncontrolled with pain medications, and some stuff like that, like any interactions or any nausea and vomiting, something like that. So, and what else? Discharge is not as bad. The what you call this, the charting, I'm still having a hard time with charting. Charting is a lot, like it's a lot of practice, but I'm doing it. I'm trying to chart as much as I could as soon as I'm done with my assessment, especially the neurological checks, like how alert and oriented are my patients, if if they are calm, if they're irritable, their behaviors, if they are alert and oriented, what else, all the assessment. I tried my best to chart what I assess the first time I interacted with my patients. And what else? I tried my best to cluster my care and prioritize my care on which one I'm gonna attend the most. It's still really hard though, but I'm getting there. Like, I'm trying my best to prioritize my patient on which patient that I would prioritize first. Oh, it's a really struggle for me to work with the IV pumps. So, but now I'm a little bit confident. I am so thankful. Sometimes I'm a little bit hesitant if I have piggyback, like if I have a primary fluids and then I have to piggyback an antibiotics or a certain medication. Sometimes I have to call my preceptor with that because I don't want to mess up the the IV pump. So I can do it, but I just want my preceptor to be with me to double check if I got everything right and if everything's hooked right. So yeah, but nevertheless, I'm a little more confident with IV pumps. I try to clear my pumps as soon as I come in during my shift and right before I end my shift. So I always clear the pumps. What else? Care plans. Care plan is a little bit difficult, but it was more difficult when I was in nursing school. Being a nurse is a little bit easier. You can say whatever you want as long as you did it to your patient. It's a little bit struggle though for me because it's been a while and I have to think of the words that I have to write on my care plan. Sometimes I have a little bit of struggle on my goals for my patient. For example, let's say stable vitals or stable blood sugars, ambulation, stuff like that. It's pretty hard, but it's okay because I always ask the nurses or my preceptor or the other nurses if I needed help, especially with care plans. What else can I say? Oh, my patient today that has acute appendicitis actually was a consult for laparoscopic appendectomy, and then that was my first patient that had surgery. So it was a little bit hectic for me when I received the patient post-op care because I don't know what to do. I mean, I know what to do, but I feel like, that imposter syndrome that you feel like you don't know anything, but you do, but you just too scared to initiate the care because you feel like it's not the right thing and you're just having doubts. But anyway, it was very simple though. Like, once you receive a patient after surgery or post-op, you just basically hook the vitals and monitor the vitals of the patient, make sure it's stable for at least an hour. So you're going to take the vitals every 15 minutes for an hour, and then make sure the SCD compressions are in place to avoid DVT. Just check the patient's orientation, if they know where they are, those neurological checks, and just ask the patient's pain if they needed something for pain, and check the continuous fluids that they are hooked on, like stuff like that. But I don't know, sometimes maybe because it was my first surgery patient, so I'm kind of a little bit hesitant with everything. But thankfully, that's why we have a preceptor, to be with us just in case if I'm not confident. So I have them to be with me. Yeah. So what I did with my surgery patient is I have to make sure that check whatever diet that is ordered from the surgeon after post-surgery. So usually they can have clears. So I gave my patient something to drink, let's say water, and then if she tolerated well, I have to inform the surgeon that that I was able to offer the patient some fluids and she was able to tolerate well. And then usually they're gonna advance the diet to regular, but you gotta make sure in the orders that they already advanced. But before you advance it to regular, you have to inform your surgeon or ask your surgeon if it's okay that the patient is advanced to regular diet. You don't want to give any diet or a certain diet to a patient after surgery without asking the surgeon or without informing them that you are going to advance the patient's diet, because you're gonna get in trouble. We don't know, so make sure you check the orders first. Anyway, before that, you also have to make sure that the patient can pee. So some patient has Foley, and then the doctor is gonna give orders that you can already pull out the Foley or take out the Foley, and then make sure that they can ambulate to the bathroom first. Take step at a time. Make sure you document if the patient went to the bathroom with assistance, and if they have peed. Once first step is done, let's say they have peed already, of course next step would be ask the patient if they can ambulate to the hallway. Let's say you can walk the patient, and once they did that sorry, oh my god, my throat is all dry. Anyway, so once your deal is done that the patient's already been ambulated, already peed, was able to tolerate their diet, next step would be you just manage the patient's pain, and neurological checks if they're still oriented, and then manage their pain. So usually you can give Toradol or Ketorolac, Dilaudid, Narco, and then also check if the doctor has orders like antibiotics to be run prior to discharging, and the continuous fluids. With my patient today, before she get discharged, I have to give the cefepime and then finish the continuous fluid of lactated ringer. So usually surgery, they're gonna give the patient with LR. So once after she tolerated her regular diet, and then the IV antibiotics are done, then I have print out the discharge. And then I have print out the discharge papers and give the patient's instructions. Tell her that, give her some education that she couldn't drive or drive any machinery or drive a car, especially when she's under pain medication, or she's taking her pain medication. She cannot lift like 10 pounds. And what else? Yeah, other than that, the routine education for discharged patient. Also, for the past few weeks, I also learned on like handling report to to patients that we're going to send back to a nursing facility. So I was able to talk to the nurse and give her or hand reports to her, and it goes smooth. And the good thing was the nurse that I handed the report used to work with us, so it was way easier. It's just that there's a lot of paperwork. But the difference with patients that going to a nursing care facility is I don't really have to do some education with the patient, and they don't have to sign the paper. All you gotta do is get the patient ready, and then the nursing home facility will pick up the patient. You hand reports to the nurse, and then the patient go. There are times that EMS or EMT or ambulance will pick up the patient. You can hand report to the ambulance and to the nurse that is going to receive in which nursing facility they're going. It's just a lot of paperwork, so I just don't like the paperwork. But other than that, everything's fine. So that's been the update. with me for a month. It's been a lot, but I'm getting there. I'm trying to give you a good vlog, but it's just impossible. I've been really tired lately, and I don't know, I feel like I don't have time. Like, every time I'm off, I clean and I don't have time to vlog. I'm so sorry. I wish I'll be able to do better with my vlogging. Like, I used to be really creative with my vlogs, but right now I'm just talking because I don't have time. So I hope this helps. And my voice is so low because my husband's sleeping. I don't want to wake him up. So yep, good night, guys. I'm still working tomorrow and Wednesday, so hopefully I can give you updates. So bye, have a good night.